Hey guys, this is the NG Tube video. Bear with me in the beginning, but I added some phone footage because I like the way I do the setup better there. So skip ahead to minute 5 if you want to move on. Was there a funny name?
No, we said Johnson.
That's the first name.
Oh, Johnson. Mr. Johnson. Hello, my name is Jamie. I'm going to be your nurse today. Can you verify your name and date of birth for me? Yes, I am Mr. Johnson. Okay, yes, I see here. I'm providing privacy. Now, I'm providing privacy for a couple of reasons. Just generally speaking, we provide privacy, but he's gonna need privacy because this isn't like a pleasant procedure. I need this to be out of my way. I have my supplies here. And remember, I'm going to say, Mr. Johnson, we're going to put that NG tube in that we talked about, that the doctor ordered, so that we can decompress your stomach. I'm going to put this on here. How do you guys think it would be best to tell him that this is going to be an uncomfortable procedure?
Straight up.
Okay, straight up. Mr. Johnson. So this procedure is a little uncomfortable, and I'm going to need you to follow my instructions, okay? You're going to listen to me. And if you need a break, I want you to lift your hand and just say, hey, I need a break. We'll pause for a minute until you're able to continue on. So I have all of my things here. I want to show you guys what I have. I would have my NG tube with the correct size of whatever we want to do. I have my suction source, so I would connect it here first. And depending on why I'm putting in the NG tube, if I'm putting it in because of gastric distension, a suspected bowel obstruction, I might have this turned on. So right when I put it in, I can just plug it right on. Again, that's from an ER perspective. We'll have to check and see like what med surg would do, but that's what I would do. So I would have that ready. And you need a tongue depressor. Oh, I need my lube. I don't have lube. So I have my tape. I'm gonna get my tape ready, and I'm gonna have it right here on my table. Or, I mean, I don't really have anything where I could stick it here. I could maybe put it right here.
There you go.
Oh, good. Thank you. So I have my lube. I could split this down the middle like that if I don't have my special nasal tape, but we do have it here, so we'll use this one too. But I just put it here, and I get everything ready beforehand because your hands are going to be busy and you don't have time to be fiddling around because you don't want that to move. So this guy here, I would peel that off. I'll put it here because it's clinging to that bed rail. So I have it just hanging there ready to go. I have my emesis basin for my patient. Here's an emesis basin for you. I have my cup of water and straw. It would be a bendy straw, and it would be icy water. I have this, and I have my measuring tape for afterwards. I have a pH strip right here, and I have my piston syringe right here. So like I was telling you guys earlier, your NG tube is going to come in this type of package. When you open it, it's going to be very stiff and like, I don't know, cold and just not very pliable. So I put my gloves on, and I am going to get it ready by coiling it in my hand and kind of warming it up. Okay, so coiling it as tight as I can and holding it in my hand. This will change the shape of it a little bit and make it easier for it to guide where I want it to go. So we'll hold that for a second. We have here, this is an adapter. This comes in this package, and when you're busy and putting this in like in an emergent fashion, this oftentimes gets thrown away. So when you go to do this procedure, when you're nurses, guys, think of me and keep this. So it goes here because this is how it would attach to the suction. Okay, so of course we wouldn't connect the suction yet, but just to show you. And then we have the air vent for the pigtail, blue to blue, and this allows air to go in and out so that it doesn't create a vacuum when it is put in and along with stomach lining. I'm just gonna do this as though I'm doing it on a patient. I might throw in some comments as we go, but so let's say we have our Mr. Jones here. We want him in high Fowlers, which I am only at 70. That's as high as our bed goes. So, okay, we're gonna say this is high Fowlers. And what am I gonna do first? Right, I'm gonna check for patency. Okay, we're gonna insert that NG tube that the doctor ordered for you. I'm gonna see here, do you have a deviated septum on either side? No? Okay. Mr. Jones, we're gonna insert this NG tube that the doctor ordered for your abdominal distension. So this procedure, I'm gonna make this more my height. This procedure can be pretty uncomfortable, so I just need you to listen to my voice. I'm gonna walk you through everything. I might have an assistant over here. I feel like no one wants to be my assistant, be on the internet, but I would normally have an assistant over here that would help me because sometimes the patients will just knee-jerk react and try to fight you. It's not that they're trying to hurt you, it's really uncomfortable for them. So the first thing I would do is I would get my NG tube ready. I put it in my hand in a very tight coil, and I kind of try to warm it up for a bit so that it will be more comfortable for them and more in line with the shape that we want to go with. Here, an emesis basin, which they can hold in one hand, and then I am going to give them some ice water to hold in the other hand. This keeps them busy, and it will help me get the tube down. So the first thing we're gonna do is we would do hand hygiene. We're gonna put our gloves on. We're going to drape this over our patient, and you will definitely need this because this procedure can definitely trigger like vomiting, possibly. We've told our patient what we're gonna do, and he is going to listen to me and help me with this. So in one hand, he's holding this in case he needs it. Oh, and I also say to him, and Mr. Jones, as we're doing this procedure, I want you to hold your hand up if you need me to stop. And then we'll just stop, pause, and take a break until you're ready to resume, okay? So that way you've communicated to them that, they can take a break. And then he would be holding this water on the other side. And then my colleague who's helping me would be standing right here just in case arms start flailing or I just need assistance because my hands are going to be busy, both of my hands. So now I get my NG tube and I have my lube. Now he is a mannequin. I don't necessarily think I can apply the lube. I would just open it and I would put lube on this distal portion of the NG tube. I would sometimes I rip it and I just stick this in here and it covers it just enough. So you can see that. It covers it just enough and then I take it out. It's nicely lubed. And then here's his cup. There's your cup. And then I am going to hold his head like this so that he doesn't resist me putting this in. And this isn't a sterile procedure because we're going into the GI tract, but we still want to protect ourselves and our patient from gastric contents that could possibly go out. Okay, so sir, I'm gonna tilt your head forward. This is really hard, look at my arm. We're gonna tilt his head forward. Okay. We're gonna tilt his head forward because we want to close off the trachea and have only access to the esophagus. Oh wait, I didn't measure. Why didn't you stop me? So we need to measure our NG tube and we're going to do it from where?
To the nose, to the earlobe, to the side.
To the earlobe. We're gonna palpate the xiphoid process, which is right about here. And then we're gonna go a centimeter or two past that so that it's nice and in the stomach. Okay, so now, since I have my marking here, I am going to mark it with a Sharpie. So I'm gonna mark it with a Sharpie because That way it doesn't interfere with the tape. If you don't have access to a Sharpie, you can use a piece of tape, but you just want to use the smallest bit of tape and put it right here so that you can see it, but when it's time to tape, this isn't going to get in your way. But the Sharpie's more clear to see. Okay, so we take our lube, open this up, stick the tube in the lube, and that covers just enough that will be enough for our NG tube. Take that off. Okay, sir, we're gonna start. I'm gonna need you to listen to my voice and follow my instructions. If you need a break, lift your hand up and we will stop. So I angle his, a normal person would be more helpful. I'm gonna angle his head down because we want to bypass the trachea and only have access to the esophagus. Okay, so the tip is going to enter your nose now. I need you to take a nice deep breath and blow out, head down, insert into the nose. You want to, even though it doesn't look like it, you want to be angling down because you don't want to go up into the sinus cavity. So we're angling down and pushing. Now at this point, they are going to start having some difficulties. So this is when you might need to take a pause. You might need to say, take a sip of your water. I wouldn't let go. And he would start to take a sip of his water and help you swallow the NG tube down. Once you get a few inches in, you're past the throat, you can let go of this. You can even say, do you need a break right now? Okay, if the patient's tolerating it fine, just continue going. Continue going, continue going. Now our little mannequin is stopping me. If this was a real human, we might be like, uh-oh, let's look in the mouth and see if it's coiling up back there. But since I know that we can't advance too far with our mannequins, we're just gonna stop right here and pretend we are at our little line that we drew. So here we are, we're done. Okay, you did great. We're all done. Let's get this secured. So we would take our tape. Oh, you know what? We would use our prep pad, clean the nose and use that sticky surface there. Put this on the nose, and then this can come off, hopefully. It's not difficult to take it off once it's on. And this just goes right around like that. Super nice. But let's just show you this way also. If you don't have access to these fancy things, which are much better, but you can put this on the nose, and then you split this and wrap this around. That way it's very secure. Okay, so now that it's in, let me tell you a couple of things about this. So if we were putting this in for abdominal distension or a bowel obstruction, it's possible that gastric contents would come flowing out of here. So we would want to be ready for that with, well, for gastric contents, we would put our little adapter on here and we would connect it here and turn our suction to, what was it? Do you guys remember? Intermittent, like 30 to 50. So we would turn that on and you would just see whoosh, gastric contents coming up, probably hundreds of cc's of fluid in our suction canister here. So we would note the color and consistency of that. If we weren't putting it in for that reason, and we were putting it more in to give meds or food or something, then we would want to attach, gather our gastric contents, check and see what it looks like. It's greenish or brown, so we're feeling like that's gastric contents. Push that back in and apply a stopcock turned off to the NG tube. We'll talk about stopcocks on another occasion, but and then we would flush this, all the gastric contents back in, and then we could leave this here. We would have a clip device of some sort that we would clip to the gown, somehow like this, so that the blue pigtail is above. Did I miss anything? Well, I guess I would measure. Okay, so now we know where we are here, but we also want to measure how much of the NG tube is coming out. So we would start with this and measure. Now this isn't going to be accurate because our mannequin doesn't allow us to advance it as much. So, you know, this says we have like 33 inches coming out, but you would want to do that for your documentation. So, and then what do we need to do before we use this NG tube? Check placement with the x-ray. Yes. Okay, and then we say, Mr. Jones, how are you? How are you feeling? And he is so grateful that we were so nice. And we did such an excellent job. So now we have our NG tube in. Is this gonna stay in for weeks and weeks and weeks? No. So this is temporary, kind of an emergency device that we're gonna use. And if he needs this for longer, we will do a G tube. Okay.